Well, good morning from the family interview area, Castle Realty. Thank you for jumping on with us this year. So excited. We have 3 days to bring you all kinds of stories, and not only stories, but what we're going to do is actually allow you to come into some of these families' homes and see what they go through on a daily basis. This is the Children's Miracle Network Hospital's Radiothon, and like we said from the family interview area, Castle Realty, thank you so much. Our daily sponsor is Carey Heating and Air Conditioning, and Scott Eppley joins me. Good morning, Scott.
Good morning. Thanks for having me.
I just had the pleasure to meet you for the first time. And look at you, all bright and bushy-tailed this morning.
Oh, yeah.
Yeah, so you hang out in the pharmacy at the hospital.
I do. Yes.
Okay, tell me about your job. What do you do?
Yeah, so I spend a lot of my time actually up on the 5th floor of the hospital in the NICU, PICU, and pediatrics area. And what we do there is help providers and nurses make the best treatment decisions for kids. We make sure all the medication orders are safe. And then down in the pharmacy, we prepare all the medications for the hospital patients up in those areas as well.
So we really don't see you much unless you're a family that has a sick little one. You know what? As we were getting some numbers together this morning, do you know that there are 12 little ones in the NICU? Explain to us what it means to be in the NICU.
Yeah, so the NICU is usually for kids who are born prematurely. So you could be born very prematurely, 24, 25 weeks into a 40-week gestation. Or it might be kids that were born a little later and then are just having some illness. So we take care of a large variety of kids in that.
And we have one in the PICU. What's that?
And the PICU is a pediatric intensive care unit, and that can be a variety of things. Again, it could be traumas that are coming in. It could be post-operative patients that just need intensive care, or it could just be any other illness that's requiring very intensive support from our staff here.
So one of the other reasons that you're here today, you have a little bit of a healthy competition going on between two vital groups here at Gunderson Health System. Can you tell us what group you represent?
Yeah, so I represent the inpatient pediatric group. We're competing against the outpatient group.
And what does that mean? What are you guys doing?
Yeah, so it's just a healthy competition, like you said. Trying to encourage some excitement for donating to the Children's Miracle Network.
So when you guys see each other in the halls and you see an inpatient team and an outpatient team, like, do you slap each other on the back and say, hey, we're doing great? Or do you know how you're doing?
I actually have no idea how we're doing. I guess we find out Monday.
Monday they announce. Yeah. They announce. So how do you vote? How do you vote for and first of all, what team would you encourage people to vote for?
Well, the inpatient team.
Oh, you would? Okay. All right. And how do you do that?
So you can either go online and vote online and designate whether you want the inpatient team or the team outpatient, or you can stop here down at the clinic lobby, and there's a table set out right in front, and there's little cards on there little donation form cards, and you can either check one team inpatient or check team outpatient right at the top of your card there. And
there again, the encouragement for you would be the inpatient.
Of course.
Yes, of course
but
it
either
would.
way, the children win. So either
Absolutely.
way, they're getting the
Absolutely.
money.
You decide who wins. It's a great idea. Give, vote, help local children and families. And I think that's why you're sitting here with me this morning.
Yep. Yeah, we really want to encourage, donations coming into the CMN. They provide a lot of support here for our families in the local community and to Gunderson. So.
And here's a really important phone number, 608-784-KIDS. And then if you don't spell it out in a word, it's 608-784-5437 and Seaman Hospital's Radiothon.com. And then that's how you can donate online.
Yeah.
Isn't that neat?
Yeah.
I think that's so neat. You know what? Thank you for taking care of the kids and the families. It's a team effort, isn't it?
It is, yeah. Multidisciplinary teams, both inpatient, outpatient. There's not just one or two people making decisions for you and helping you make decisions. It's a large variety of people. So we're very team-based here.
Well, just in our short time that we spent together this morning, I think our families and their kids are in good hands.
Oh, yeah.
Thank you.
Thank you.
Thanks for
having
spending
me.
some time with us. So we're off and rolling. 784-KIDS, 608-784-5437. CMN Hospital's Radiothon.com to donate online. And we would love to thank Castle Realty for jumping on with us for the family interview area. Now, we have some people already ready to answer the phones at the Blood Center of Wisconsin, our phone banks, and they're just ready, and they're looking at me like, why is this phone not ringing? Now, I know, Scott, that people get up early in the morning. Point
people
taken.
do,
There
yes.
you are. And here I am. So let's get these phones ringing, 608-784-KIDS. What we're going to do is we're going to have conversations today, tomorrow, and Saturday, meeting a whole lot of families and friends. Scott, thank you so much for joining us.
Thanks for having me.
All right, very good. Okay, thank you so much. We're off and rolling, and we're live, the Castle Realty Family Interview area from the Gunderson Health System lobby, a service of the La Crosse Media Group.